In the last video, we used delicious baked goods to illustrate how chronic rheumatic fever causes mitral stenosis. And before that, we showed you how acute rheumatic fever causes acute mitral regurgitation. Well, what if I told you we're not done with mitral regurg just yet, huh? What if I told you there are actually a bajillion different things that can cause mitral regurg? Well, just close your eyes, hang on tight, clench your gluteus, and take the plunge as we illustrate the what, why, when, where, and how, and quite possibly the whence and wherefore of both mitral regurgitation and a related condition called mitral valve prolapse. Welcome to the Jester Jump Club. Believe me, my friend, once you feel the chafe of a rudimentary fashion medieval motley jester suit whilst falling at terminal velocity, you'll never skydive any other way. Aw, look, this guy's a little nervous about his first jump. Come here, you. He's what we call a junior jester. We'll take it slow, don't worry. That jester hat is our recurring sketchy symbol for a floppy and incompetent mitral valve. See those two sagging bicuspid points? And as our newbie here nervously regurges all over himself, I want you to imagine systolic contraction sending blood shooting backwards through that mitral valve. Hey, did I tell you we also do parasailing? When you look at that parachute, I want you to imagine the two leaflets of the mitral valve billowing back up into that left atrium. This is called mitral valve prolapse, and it's the #1 cause of eventual mitral regurgitation, which is when blood actually starts shooting back through. So why do the leaflets like to parachute upwards like that? Well, it's usually due to a disease called myxomatous degeneration. And in this scene, when you think of myxomatous, think of a mixer, like the one propelling that parasailer forward, defying all laws of physics. Myxomatous degeneration is just a special name for the pathologic deterioration of the connective tissue that holds the valve together. So if you look closely, you'll notice that our myxomatous mixer is starting to get tangled in the connective bands there. That won't last long. You'll sometimes hear other terms thrown in there, like redundant mitral leaflets and elongated chordae tendineae, and that the fibrosa is thin and the spongiosa is thickened. But just remember that we're deteriorating connective tissue here. Myxomatous degeneration is a chronic disorder, but the mitral valve can prolapse right back up into that atrium acutely as well. This occurs during chordae tendineae or papillary muscle rupture, when the chordae that hold the leaflets are let loose, leading to acute mitral prolapse and regurg. We've seen this happen before, during a right-sided MI, for example. At Sketchy, myocardial infarction is always represented by a ruptured heartstring. Recall that the posteromedial papillary muscle is usually fed by the right-sided coronary circulation. Cut off its blood supply with a thrombus in the right coronary, and that ischemic papillary muscle may just rupture. Remember when I said that myxomatous degeneration is a chronic disease? Well, when it affects the chordae, the connective tissue can get stretched and weak, and sometimes it acutely ruptures. Honestly, that thing really shouldn't be flying anyways. Another important cause of chordae rupture is infective endocarditis. At Sketchy, myocarditis, or inflammation of the myocardium, is represented by a heart on fire. Endocarditis, on the other hand, which involves inflammation of the innermost endocardium, is depicted as a fire coming from within the heart. So we usually use a heart-shaped lantern, like the one this guy is using to signal for help. As we'll illustrate in our infectious disease unit, infective endocarditis involves bacterial infiltration of the endocardium, and that means the valves are involved as well. If enough damage is done to that mitral valve, the chordae can acutely rupture, leading to acute mitral regurg. Okay, so in the left corner of the sketch, we've illustrated a few reasons why that mitral valve will acutely start sending blood in the wrong direction. Hyperacutely, in fact, due to immediate rupture of supporting structures. It's not hard to imagine that the heart does not have much time to respond. Let's look at the hemodynamic consequences. First, imagine the left ventricle pumping underneath that acutely ruptured mitral valve. Instead of blood heading out through the aorta, A ton now shoots backwards toward the left atrium. Say goodbye to cardiac output. It's kind of like the low output on this cardiac flashlight here. So, since blood is shooting backwards instead of out to the circulation, it accumulates in the left side of the heart. And when the ventricle fills again during diastole, it now has to accommodate the regurgitant blood volume along with the normal pulmonary venous return. In other words, there's an acute increase in end diastolic volume. That means an acute increase in preload. Preload, remember, is the volume that the heart has to move with each contraction. At Sketchy, preload is represented by a load getting pulled, as depicted by this concerned gesture here, pulling on his unconscious friend who has just suffered a major rupture. Retrograde flow causes increased pressure in the left atrium, which transmits all the way back to the pulmonary vein, causing pulmonary venous hypertension. This will manifest as flash pulmonary edema, depicted, as always, by a soaked pulmonary life vest. As the ventricle contracts, that regurgitant mitral valve now provides a new low-resistance path for blood to travel. This translates to a decreased afterload faced by the heart. If preload is the volume in the chamber that the heart has to move, afterload is what the heart has to push against in order to get its load out. So at Sketchy, we represent afterload with someone pushing against a load. And since afterload is acutely diminished, his load is sent cascading off the side of the canyon. This will actually cause an overall increase in ejection fraction. The ventricle has a larger volume to deal with, sure, but now it has 2 outflow tracts through which it can eject blood. So it's able to empty more of its contents. At Sketchy, increased ejection fraction is represented by a fraction lifted into the air. So you see the wedge shape cut into this heart hang glider? Kinda like the fraction of a pie graph? As he takes off into the air, imagine ejection fraction increasing. Whee! However, this does not mean increased cardiac output. Remember, a lot of that stroke volume is sent in the wrong direction, back toward the atrium, so cardiac output drops. If severe enough, this leads to the abrupt onset of cardiac failure, severe hypotension, and cardiogenic shock. At Sketchy, shock is represented by a lightning bolt, like the one labeling these batteries here. This is one of the feared outcomes in the first 10 days following a right-sided myocardial infarction, for example. That ischemic posteromedial papillary muscle might just rupture on you, causing complete cardiovascular collapse. Hey, where are you going? What? No. These are just some extreme examples of hyperacute mitral regurg. Because it happens so fast, the heart doesn't have time to respond. Don't worry. Just put your jumpsuit back on. It'll be okay. Because most of the time, the regurg starts out small, or it develops more slowly before becoming clinically significant. That way, the heart is able to adapt. Let me show you what I mean. You remember mitral valve prolapse, right? That billowing parachute of a mitral valve caused by myxomatous degeneration? I mean, look how much fun that guy's having back there. Yes, the occasional rupture can occur, but in most cases, mitral regurg develops gradually, remaining asymptomatic for years. Rheumatic heart disease is another good one. Recall from our last sketch that acute rheumatic fever occurs because your own immune system tries to attack a group A strep infection, but attacks your body instead. This leads to acute rheumatic fever and all those acute Jones criteria symptoms, including valvulitis. Just from this one episode, the damage to the mitral valve can be permanent, and a slow, progressive mitral regurg develops over time. This is called chronic rheumatic heart disease. Stenosis is actually more common at this late stage, but regurg is often present as well. And yes, we're bringing back endocarditis. Hence the return of our recurring heart lantern with that fiery inner surface. After crashing in the forest a few days ago, it looks like this motley fool has finally made it back to camp, accumulating some vegetation along the way. You see that sagging bicuspid hat, covered in debris? In the setting of infective endocarditis, bulky vegetations composed of bacteria, inflammatory cells, and fibrin develop on valve surfaces and cause direct destruction of the underlying valve architecture.